Good morning. I'm Anitra Galmore, Vice President of Nursing for SSM Health St. Joseph Hospital in St. Charles in Wentzville. I'm honored to be here with you this morning. I began my career as a medical assistant in an obstetrician's office, and I have worked for SSM Health for more than 25 years, over half my life. And I might need some readers. My journey has been a testimony of God's power and presence through people. Today, I'd like to share with you a few stories about how I have experienced God's healing presence and the profound impact it has had on our patients, their loved ones, and my own family. Upon arriving to work one morning, I was greeted with a request from a family member of a former patient. Good morning, Anitra. This person is demanding to speak with the president or vice president. She refuses to speak with anyone else and will not divulge details. This occurred the Wednesday before Thanksgiving, and she made clear that since hospitals are a 24/7 operation, there should be a person of authority available and present. I called her, anticipating a complaint or concern, and she insisted on speaking with me in person. We made arrangements, and she arrived for our meeting within the hour. She presented sad, closed, and appeared to have been crying. She began by telling me how complex the nursing occupation has become, how valuable nurses are, and how important nurses are to ensure patients are fully cared for, mind, body, and spirit. Her brother had become ill due to multiple comorbidities. This gentleman was a sound business owner, a veteran, and a great provider for his family. She stated that due to his failing health, he had lost his business, his family members were estranged, and he was experiencing significant financial burdens. Over the course of multiple admissions at local hospitals, she said he had been treated poorly and was judged for being underinsured and eventually uninsured. The man he once was all but forgotten. Then one day, she received a call to come to the emergency department at St. Joseph Hospital in St. Charles. Her brother had taken a turn for the worse. She stated that every team member she encountered treated him in a kind, gentle manner, respectful of his wishes as well as hers. She said, "It was important for me to let you know that when I arrived in your ICU, I did not expect the positive experience I had in the ED to be duplicated. I was wrong. Your staff are angels sent by God. My brother passed away in peace. As a result of the kindness and compassion your staff has shown, I have also found peace. You gave my brother his dignity back, and I needed to personally thank you for that." I was deeply moved by her story, fought back the tears, we shared an embrace, and she went on her way. Earlier this year, I found myself in a position similar to hers. On April 13th, my dear partner, Jill, was in a serious car accident, hit head-on at 80 miles per hour by delinquents who were eluding the police. In an instant, I became the family member in desperate need of God's healing presence. Without hesitation, I began to pray they would transport him to an SSM Health facility. God heard my prayer. He was taken to SSM Health St. Louis University Hospital. I called SLU Hospital to let them know I had a family member on the way. My drive there from Wentzville felt like it took days. I tried to compose myself upon arrival and found myself uttering words I've heard from so many family members over the years. Please just let me see him. Please save him. Of course, I was not allowed to see him at that time due to the severity of his condition and the life-saving measures that were taking place. I felt overwhelmed with fear and anxiety. I remember Jacob, the team leader in the ED, and Jennifer, the administrative supervisor, standing next to me with open arms. I saw them as angels sent to me by God. They embraced me and my family, comforting us with prayer, advocacy, and support. They placed us in a private area, kept us updated, and reassured us that the team was working hard and that Gerald was in the best hands possible. Together, we made a plea to God to preserve his life. His healing presence was truly at work through the SLU Hospital trauma team. Doctors Watson, Espinoza, Sam, Kelly, Drew, and Paris. These and many other individuals cared for our every need and created a plan of care for Gerald's recovery. They reduced his suffering in various ways, some as simple as keeping him clean and groomed, and some more complex, such as titrating pain medications to balance his comfort and conscious levels. All the clinicians involved in this case knew how we longed for some good news, for a little hope. In the arduous days ahead, physicians spoke to us with the utmost respect and compassion. They took time to fully explain their observations and recommendations and encouraged us to continue taking care of ourselves, aware of the long journey we had ahead of us. Trauma surgeons prayed with us regularly, and there were a few specific Bible passages that stuck with me that I'd like to share with you as well. Matthew 18, verses 19 through 20. Again, truly I tell you that if two of you on earth agree about anything they ask for, it will be done for them by my Father in heaven. For where there are 2 or 3 gathered in my name, there am I with them. We were told Gerald could be in the ICU for up to 2 months. He had a panfacial fracture. Every bone in his face had been crushed, as well as his right leg. He had multiple other fractures, a lacerated spleen, and bruised lungs. By God's grace, he was downgraded in 2.5 weeks. On May 9th, was moved to SSM Health Select Rehab. Today, he is ambulatory, using a walker, and is working hard with his awesome therapy team, Craig, Paul, Josephine, and Jennifer. Gerald's journey started in an SSM Health facility, and he continues to progress every day, physically, mentally, and spiritually. As a man of deep faith, he appreciates the stories we shared about his care team and their exercise of faith and prayer on his behalf. I personally am eternally grateful to our founding sisters for their vision of a healing ministry. I am honored to be a part of a legacy that adheres to the spiritual standards set for us so many years ago. I was fortunate to be present when Sister Mary Jean Ryan spoke at this very leadership conference 4 years ago and told us, "It's in your hands." Her words resonate with me this very day. I have always considered myself an accountable leader, now even more so. As an SSM Health caregiver, I take personal responsibility to lead and challenge teams to continuously improve care delivery through relationships with patients and families. I actively support and engage a diverse and inclusive workforce that removes barriers to anything less than exceptional, aligning my belief systems with the standards of the sisters. I believe that exceptional commitment, care coordination, urgency, and passion can lead to positive outcomes despite the way situations may initially present themselves. The SSM Health team that saved Gerald's life confirmed for me that the sisters' calling, my calling, and yours, is to support our patients and families to ensure their experience at our entities is an exceptional one that truly reveals God's healing presence. Thank you for allowing me the opportunity to share my story and Gerald's story. I'd like to leave you with one final passage that helped me stay optimistic during those tough times, even when things were at their bleakest. Matthew 19, verse 26. Jesus looked at them and said, "With man, this is impossible, but with God, all things are possible." Thank you.